Tomorrow, a bunch of different groups are going to rally in Buffalo to call on New York State to cover that gap. Union healthcare workers joining others to declare what they're calling a code red and warning of the consequences for coverage. Think of this, in our 8-county region, more than 400,000 people get their insurance through Medicaid, which was cut nearly $1 trillion by the federal government in that bill. Debora Hayes is Area Director for CWA District 1, one of the groups participating in this event tomorrow, and she's here tonight to tell us about it. Debora, great to see you.
Great to see you as well.
So walk us through. We knew that the health care cuts were coming. There's a lot of discussion on this now because it seems like we're getting more to a point where this is going to really start impacting people.
Absolutely. The cuts from the bill that was passed in July are $1.8 trillion. $2 billion deficit gap in funding for Medicaid in New York State. And the impact on Western New York, which is already an underfunded portion of the state, will be devastating. We're expecting that hospitals and nursing homes will close, that services will be cut, and healthcare workers will not be able to provide the care that is required to people in our community.
The plan, or at least the proposal from your group and others, is saying to New York State, look, you've got to cover this gap. $2 billion is a lot of money. What are you hearing in terms of if that's possible? Obviously, budget negotiations are going on right now.
Budget negotiations are going on right now, and what we're hearing is that there is the ability and the excess in revenue that would allow the state to cover these budget cuts. And so that is the purpose of tomorrow's rally. We have the Area Labor Federation, 8 unions, faith leaders, community advocates, everybody coming together to say to our leaders in New York, you must fill this gap or the impact on our system will be devastating.
We heard from the beginning that the biggest impact from these cuts to Medicaid and then sort of the ripple effect that impact even Medicare could face a cut because of how all this works itself out. But the biggest impact could be on rural hospitals. How concerned are you? I mean, in Western New York, we certainly have a few rural hospitals. A lot of our hospitals are in sort of more urban areas. So how do you see that impacting our region specifically?
The urban hospitals tend to be the ones that are the most challenged economically, and so any change in the revenue that they receive could be devastating. In Langworthy's district, there are 7 hospitals alone that more rural hospitals that have the potential to close, and the Fiscal Policy Institute tells us that there are at least 70 hospitals across the state that could close as a result of these cuts.
Finally, what do you say to the folks who believe that these cuts can be implemented by getting rid of waste, fraud, and abuse? We've heard that from Congressman Langworthy himself, who you mentioned there.
It is absolutely not true. What many people don't realize is that hospitals and nursing homes count on Medicare and Medicaid funding to care for everybody. It's part of their revenue stream, and it goes to providing care to our community. The no waste, fraud, or abuse is evident in our facilities, and much of the extra, if you will, that could be cut has been cut. So we are really down to bare bones, and the cuts that are coming now are incredibly painful.
Debora, thanks so much. We'll be following this story tomorrow again as you have this event, noon tomorrow in Buffalo?
Noon to 1 o'clock at 2421 Main Street, Code Red for healthcare in our community.
All right. Debora, great to see you. Thank you very much.